him in continuation of our previous lecture. This is your surgical supplies part 5. So in continuation of previous lectures, so we were discussing in previous IV cannula. So a cannula, IV cannula is a tube that can be inserted into the body, often for the delivery or removal of fluids. IV cannula is inserted into a vein primarily for the administration of intravenous fluids, for obtaining food samples, for obtaining blood samples, and for administering medicines. The average cannula size is 14 to 26 gauge. 14 is largest and 26 is the smallest. You can see a picture of IV cannula. Now, otoscope. An otoscope or oriscope is a medical device which is used to look into the ears. Disease which may be diagnosed by an otoscope includes otitis media and otitis externa, infection of the middle and outer parts of the ear, respectively, it was examined by the otoscope. You can see here is a picture of otoscope. Further, ophthalmoscope. Ophthalmoscopy is a test that allows a health professional to see inside the fundus of the eye and other structures using ophthalmoscope or fundoscope. It is used to detect and evaluate symptoms of retinal detachment or eye disease. Eye disease and evaluate symptoms of retinal detachment or eye disease such as glaucoma. You can see this is a ophthalmoscope. Colostomy kit. A colostomy kit is a surgical procedure where the colon is bypassed and the intestine is rerouted to an opening on the abdominal wall called a stoma. Again, I repeat, a colostomy is a surgical procedure where the colon is bypassed and the intestine is rerouted to an opening on the abdominal wall called a stoma. A plastic bag is attached to the stoma that collects feces passing through the intestine as waste. You can see it is a colostomy bag over there. Laryngoscope. It is an instrument used to obtain a view of the vocal fold and glottis. Contact lenses. Contact lenses are small, lightweight plastic devices worn on the eye that correct refractive errors in vision. A lens is corrective, cosmetic, or therapeutic lens usually placed on the cornea of the eye. It is also known as contact. Many commercial lenses are tinted a faint blue to make them more visible when immersed in cleaning and storage solutions. You can see how this contact lens is placed over the cornea. Complications of contact lenses. Complication due to contact lens arises roughly in 4% of contact lenses. Problem associated with contact lenses, wear may affect the eyelid, the conjunctiva, the various level of cornea, and even the tear film that covers the outer surface of eye. Insertion. Contact lenses are typically inserted into the eye by placing them on the index finger with the concave side upward and raising the to touch the cornea. Removal. A soft lens may be removed by holding the eyelids open and grasping the lens with opposing digit. Care. While daily disposal lens requires no cleaning, other types requires a regular cleaning and disinfecting in order to retain clear vision and prevent discomfort and infection. Nebulizers. A nebulizer is a device that uses compressed air to deliver medication to people in form of a liquid mist to the airway. It is commonly used in treating cystic fibrosis, asthma, and other respiratory diseases. They are also called at- atomizers. They pump air or oxygen through a liquid medicine to turn into vapor, which is inhaled by the patient. You can see the picture of a nebulizer device. Parts. Nebulizer have three main parts: a cup that holds the medication, a mouthpiece or mask attached to a T-shaped part, and a thin plastic tube that connects the mouthpiece to the compressor. Medical surgical gloves. Until late in the 19th century, most surgeons used to operate with their bare hands. A few doctors tried cotton or silk gloves, but they proved impractical and impossible to sterilize. Today, sterile disposable gloves are in common use by medical professionals. You can see this type of a surgical gloves. Nasogastric tube or common name is Ryle's tube. It is an agent used for nasogastric intubation, a medical process involving the insertion of a plastic tube, nasogastric tube, or NG tube through the nose, past the throat, and down into the stomach. It is used for the nasogastric introduction for drugs and other oral agents and aspiration of intestinal secretions or drugs, and for minimal quantities of liquids. A syringe is used for injection into the tube. You can see how it is applied inserted through the nose. That's the nasogastric tube. So that's all from this surgical supplies. So this is usually how it is. But feeding tube goes through this and directly go to the stomach. It is a feeding tube, esophagus, stomach, nasogastric feeding tube, and nasojejunal tubes. If further, it has to be go to the jejunum. So this all from the uh, service suppliers. So next time we'll discuss about a new topic, that is inspection of the wards.